we are going to announce our drawing winner at the end. And so while we're doing that, I'm going to be writing down the names on scratches of paper and putting it in my little bucket. And I will draw that drawing at the end. And you do need to be present to win. And what else? What else am I missing?
You should just like both of our pages and comment a friend in there and like the post.
Yes.
And that's it.
So before we get started, because we'll wait for a few people to join on, I just wanted to share with my fellow lupus warriors that I am actually having a really bad lupus day today, or fibromyalgia day, or both. So I know that I look fabulous now, thank you, but I'm not feeling too good. And so I just wanted to share that transparency that things aren't always as they appear. And so a lot of times when we're on social media, there's a tendency to compare our inner experience to other outside appearance. And just because someone looks like they have it all together, or that, you know, life is grand, that doesn't mean that they're not also struggling or in pain or severely fatigued or whatever the case might be. So I just encourage everyone who's watching to just be kind to yourself and be compassionate and, you know that everyone has their own struggle. You know, maybe different than yours, but everyone has their own struggle. You want to add to that?
Yes. And we had a phone call this morning talking about how I believe I'm also having a really rough day. I got up early with the kids, and about an hour and a half later, I was so tired that I had to take a nap. Mm-hmm. I had to take a nap after just an hour and a half of just getting up, going, talking to the kids. Made one kid breakfast, one had already eaten. And during flares, I can be that easily fatigued that just walking around my house for an hour just completely knocked me out. Yeah. So I'll be going into the doctor's office after this call to get some blood tests because it seems like something's happening. And so part of lupus for me, since I'm earlier in my diagnosis, is finding out what triggers flares. So I'm not exactly sure. It could be related to my cycle. That's one pattern I've noticed. But I also look amazing. But I'm feeling tired. Right. But I'm wearing this purple scarf, one, for Lupus Awareness Day, and two, because my hair is thinning. I've had some of that from lupus, and also because I was too tired to hold my arms up to comb it. And that's real life. Yeah. And that's how I've had to adjust my life since my diagnosis.
Yeah. Thank you so much for sharing that. And I was actually just sharing with Dr. Hill this morning. I was like, girl, I have hair loss too, but you don't know if I colored in my eyebrow pencil. It's like multi-use because I don't use a lot of makeup, but I definitely do my eyebrows every day. And so I do my eyebrows, I do my sides. What'd you say?
The eyebrows frame the face.
Yeah, exactly. And they look atrocious without a little help in the morning, girl. Hi, welcome, Bus 12B.
Welcome. Thank you for joining us.
I think we will go ahead and get started.
Yeah, when people join, they'll join. Yeah. So I'll be taking lots of sips of water. Like I mentioned, my throat, my mouth are very, very dry.
Yes, and I have iced tea that I made. I mixed some nettle tea with some chai tea, and nettle is actually really good for you for your like reducing inflammation and so many other things. It tastes like it's like a mix between like dirt and cat litter or something. It's like really like the way they'll smell. That's how it tastes.
Okay.
I love this 101, so it's we're talking about nettle tea, so it's not great. But actually, my doula had recommended for me to start drinking nettle tea when I was having some complications after having my last baby. So we'll talk about that and like the godsend of Black doulas. So make sure that I remember that.
So, yeah. All right. And hi, One Blue Hog. Thank you for joining. All right, so we're going to start off by just sharing our stories. This talk is all about being able to encourage you wherever you are in your lupus journey, in your lupus and pregnancy journey. We have very different stories, but our stories interconnect in a cool way, I think. So of course, as a disclaimer, we are sharing our stories as part of a way to normalize and just talk about lupus and pregnancy. But for any medical advice or mental health advice, we would encourage you to reach out to your local professionals so that you can get the help that you deserve from a place that is more appropriate. So this is all just for information purposes. Okay, so let me start. I was diagnosed with lupus in November of 2018. I had my first baby in August of 2013 and my second living baby in July of 2017. Mm-hmm. So I got my lupus diagnosis after all of my pregnancies. But when I got my lupus diagnosis and she looked over all of my records, it looks like I've had lupus since 2010. So I did have lupus during both of my pregnancies, and it was more active around those times, especially around my daughter's time. But I wasn't diagnosed.
Average is like 5 to 10 years of having symptoms before people are diagnosed. Yeah. So what you experience, unfortunately, is way too common. It's really
so common. Really, really unfortunate. So my main symptom was I had pericarditis, which is the lining of your heart swelling up. And mine was swelling up again and again, and they couldn't figure out why for years and years and years. And I was actually referred to a rheumatologist in 2011, and he dismissed me. He said that I was too sensitive to pain. It was all in my head. He said, you just have fibromyalgia. First of all, as if fibromyalgia isn't a real thing. And then second of all, just gave me some antidepressants and told me to go on my way. And so when my recent rheumatologist looked at his record, she said, you had lupus then. I can see his test results. You had lupus that day. He should have caught it. Mm-hmm. Before as for my pregnancy journey, when my son was born, he was not necessarily planned. He just a God said, right? And I almost forget this part, but the doctors told me at the beginning, they said, we think you're having a miscarriage. And I prayed, and then I didn't have a miscarriage, forgot all about it. His pregnancy, I'm not a pretty pregnant person, so his pregnancy was a small slice of hell. But there were no complications. Oh my God. No complications, nothing was wrong, right? And his labor was 26 hours, but he just, once it came time to push, I think it was like 3 pushes and he was out. Wow. So nothing was really happening. At one point in time, and they were all very big. At one point in time, they said, I think there's something wrong. They sent me to a specialist, a maternal health specialist. They couldn't find anything, and they sent me on my way. But I think my body was trying to say something during that time. But I think that first pregnancy was actually very regulating for my system. So the chronic cysts, I had ovarian cysts that I had, went away during that. My eczema cleared. There was a lot of stuff that cleared up during that time. And even my pericarditis cleared up during my pregnancy, that first pregnancy. Mm-hmm, mm-hmm. After my first son, Jackson, we got pregnant again, and I lost that baby at 7 weeks. And I was completely floored, and I didn't understand why. It seemed out of the blue. And then I got pregnant again shortly thereafter, and I lost that baby too. And that's where the story gets interesting, because in that second loss, I was seeing this specialist, and she told me, I was crying in her office. She said, I know you're going to get pregnant again. I know you are. And I don't know what's happening, but my gut tells me that there's inflammation in your body. And something about you losing this baby is connected to the inflammation. And I don't know what it is, because I'm not an inflammation specialist, but it's in my gut. And the next time you get pregnant, I want you to take aspirin every single day. No matter what anybody tells you, you take aspirin every single day. And I had a pericarditis flare right before I lost the baby. And so then when I got pregnant with my daughter, Ellie, that pregnancy, I had a lot of difficulty. And so the most difficulty was that they thought I had preeclampsia. And so there was just protein just spilling out of my urine. But my labs in terms of the other functions, like my blood pressure was fine, but they still wanted to deliver her early because they were really afraid that something was going to happen to me. Yeah. So they tracked me every day and let me get to 37 weeks. And so they induced me, but my body had been going into labor for about a month prior, which was interesting. They call it prodromal labor.
Yeah.
And it was rough.
Yeah.
It was rough. I don't recommend it if you can avoid it. But it was labor every single day for about 2 hours. And it was real labor. It wasn't Braxton Hicks. It was actual labor every day for a month. And so they induced me, and she slid right out of there. 7 hours from the time they gave me that pill to the time she came, she just slid right out. Easiest labor of all time.
Wow. Yeah.
And then right after she was born, I got shingles. Right after that, I started getting migraines for the first time in my life. And then shortly after that, I was having trouble driving. I felt like I would drive home, and then I couldn't get out of the car. I couldn't stand up. I was crying, and I felt so weak, like my battery was draining. And then that was when I was finally diagnosed, and the doctor was able to look at my labs, and it was a woman of color. I don't think that that's by chance that she was the one who picked this up. Yeah. But she got all of my labs, and she mapped them onto a graph. And she was like, look at what happens when you were pregnant. You had spikes and inflammation during both of those miscarriages. And I think that your body was throwing clots. And so when you were pregnant with Ellie and you took that aspirin, that kept you from throwing the clots. And that is why that baby lived.
Wow.
And so I was diagnosed at that appointment. And then they told me that I have lupus nephritis, so I had kidney involvement. And then recently I've had chronic kidney disease. And so one part that I'll talk about when we talk about our mental health portion in a few minutes is what's been hard for me is they've told me that I'm actually not able to have any more children because they think that it would probably kill me or the baby at this point in time. And I have two, and I'm okay with that. But I think being told that you can't have more children as a young woman has been really, really hard. And having your fertility impacted. So some of the medications are also impacting my menstrual system so that I have some menopause-like symptoms. And so now I'm dealing with that side of fertility. So that's my journey so far. And I wanted to bounce it over to you, Dr. Blied.
Thank you so much. Like, wow, this is the first time that I'm hearing your full story. And like, man, I'm good. All right, so let me share my story. So I was diagnosed with lupus in 2012. I had my first daughter in 2007. And how old was I? I was 22 when I had her. And then a few years later, I was diagnosed with lupus. And my doctors actually caught my lupus pretty early before there was some major organ involvement. And I shared this on Saturday when I was live with the House Foundation. It was very strange and very like divinely ordered that I was diagnosed so early because I had actually like went to the doctor because I thought I had diabetes. It's really strange. Because I was getting really tired, like super fatigued, and I had pain, but it was more like, oh, I was in grad school at that time, so it's like, oh, I'm stressed out, I'm in grad school, I have all these, responsibilities, and I'm a single mom, like, that's why I'm experiencing this. But the weird thing was I was getting like super fatigued, And like I would be so tired, and then I would eat something, and then I'd feel better, and I'd be able to get on going about my day. But then there would be some kind of like crest or breaking point where like I don't know if I'd eat like too much or the wrong thing, and then I would like fall asleep for like 4 hours, like really long naps during the day. And I'm just like, my grandfather passed away from diabetes complications, so I was like, oh, it must be something with my blood sugar. So I went and got checked out, and the doctor was just like, hey, you know, there's something, you know, not right or whatever. And so he was just like, you know, go ahead and come back. And when he came back, or when I came back, he was just like, well, the first thing that they saw that my white blood cells were like at 0. Mm-hmm. So like normal level for your white blood cells is like between 4 and 11. And mine were like either 0 or like 0.1 or something like that. So he was just like,
mine were taken too.
Yeah, he was like, it's either cancer or HIV or an autoimmune disease. I'm not sure. See you next week. I was just like, what?
Oh my goodness. Next week. Sure.
Part of our talk is going to be how Black women are treated by this medical system.
Yeah.
So that's one. So I came back the next week, and he was just like, good news, it's not cancer or HIV, but you definitely have something autoimmune going on. You had a positive ANA, I'm going to refer you to a rheumatologist. And then he was like, and don't go home and Google autoimmune disease. So when I went home and I consulted Dr. Google. I said, what is wrong with me? So I'm putting in my symptoms, the positive ANA, and I'm saying all these things. And I see your
question.
I define Lupus Inc. We're going to get to the questions at the end for sure. So you guys keep sending in your questions. And so to make a long story short, went to that rheumatologist, got some more blood work done, told him about my symptoms and stuff, and he was just like, I think you have lupus. You know, and, you know, could be, you know, some fibromyalgia involved. He was like, you know, as far as the definite test for lupus, there's nothing yet unless we go into your spinal fluid. I was like, no, don't do that. But he was just like, you know, so we'll just, you know, I think this is what you have. Let's keep monitoring it. And I fired him. I was just like, I rebuke that in the name of Jesus. I do not have lupus. And then I just disappeared. I kind of just went off the grid for a little bit. About probably like 6 months later, I went to a brand new doctor, brand new clinic, brand new city, who knew nothing about me. I was just like, oh, I don't have any medical records. Like, and so I got a physical. And she took one look at my lab work and was just like, do you have lupus? And I was just like, it hit me like a ton of bricks. And I went in my car and I called my mom and I cried because before, when I was looking up lupus, the words that kept showing up on the internet were chronic and debilitating. And I was like, wow, you know, what am I going to do? I have this 4-year-old, you know, at that time, you know, there were some issues with my ex-husband, her father. So I was like, you know, what if I die and he gets a keeper? And I'm like, oh God, you know, so every anxiety, like everyone, and it was, you know, horrible, whatever. So that's kind of like being diagnosed with this. It was really early. I did have, you know, my liver functioning has always been a little off, but it's not super like severe. But in 2019, wasn't that long ago? 2018.
Last year. Okay,
Lupus Bond, like Lupus brand is the real thing. So the cognitive disruption is a real thing.
Yeah, anyway, for those of you who have just joined, we both share that we're both probably in a flare right now. So we're on the struggle bus a little bit.
But 2018, when I was trying to get pregnant with my husband, it was actually Dr. Hill who told me, hey, my doctor told me this, you know, take aspirin every day. You know, she was just like, you know, take it or leave it, ask your doctor. But I was just
I have no recollection of this conversation, so it was all God. Zero recollection of this conversation.
And I was just like, okay. And so when we started to try to get pregnant, I was already taking my prenatals and I was taking my aspirin every single day. And so I really feel like my daughter, she's 9 months old now, being alive today is because of Dr. Hill giving me that advice. And it was interesting because my OB was like, that's interesting, but whatever, I'm not the rheumatologist.
Right. My OB was like, I don't know why, but whatever.
Right. But I'm just like, look, I'm going to take it. I don't care what you say. I'm going to take it. My girlfriend told me this is going to take her baby. This is what I'm going to do or whatever. And then when I went to my rheumatologist a few months into my pregnancy, he was just like, oh, how did you know that? He was just like, that's very good. Keep taking it. Because if you look online about aspirin, you actually shouldn't take aspirin later in your pregnancy because it can cause complications.
Right.
That's not the case when you have an autoimmune, when you have this increased inflammation with lupus and things like that. And again, disclaimer again, we are not physicians, and even if we were, you're not your physician.
Right.
So ask your doctor. So
if you don't like your doctor, go get you a new doctor.
Yes. Our doctors serve us. And so if you have a doctor who is ignoring your symptoms, who is dismissing you as, oh, it's just that, oh, you're just complaining, that person needs to be fired.
Yeah.
Because you are paying them, your insurance is paying them, and they should really, serve you. So anyway, my first pregnancy was a breeze. I was working until like a week before I delivered. I was still like walking everywhere or whatever. But again, I was in my 20s. Now that I'm in my mid-30s, my body was just like, it was different. I had every pregnancy symptom that is listed in the book. It was by the end, with being high risk because of lupus, starting at 20 weeks, 22 weeks, I had to go to the specialist every single week, twice a week, for a fetal non-stress test, where they were monitoring the baby's heartbeat and the baby's movements, and then doing ultrasound to, monitor the amniotic fluid and all that. That was twice a week, and seeing my OB. So it was really expensive. So that plan was super expensive. But, that was kind of something else that had happened. And I wondered, how are we doing it with our time? Because I could just go on and on and on and on. Because I wanted to share about my post complications.
You got some time.
I got the time? Okay.
Yeah, we'll make it up.
During my pregnancy, my lupus actually went into remission. And it was actually Kimberly from the Purple Rose Foundation. You can find her group on Facebook. She was saying that during her pregnancies, her lupus went in remission. So me, being a scientist, I was like, well, I need some evidence. I need some reasons why this might happen. So I went to Google Scholar and I was like, lupus and pregnancy. And there's so many scientific research articles that show that there's this symbiotic relationship during pregnancy with autoimmune, where it actually, all the symptoms quiet down because something that the fetus is doing with the body. And they all warned that, and my rheumatologist told me the same thing. What often happens is after you deliver, and that little baby is not in there, you might have a major flare-up.
Yeah.
So that was actually the case for me. I'm not sure if it was so much of a flare, but I had a lot of postpartum complications, and I almost died. Like, I'm really grateful to be here today, where one, as far as the lupus part is, my kidney functioning had gone down to less than 60%. So that was like the lupus part. So my doctor was just like, we're just going to keep monitoring it. If it continues to get worse, we're going to have to do a biopsy or whatever. But I had a C-section. I had a repeat C-section, also at 37 weeks. And it was actually, and they had it, I had it early because of my high risk. But also that day when I went into my C-section, my water broke. So it was time.
The baby, It was early.
I was really busy. I could barely walk. It was bad. My pictures are cute, but it was still real bad. I was not feeling it. And afterward, I ended up hemorrhaging 3 times within those first 3 months of delivering my baby. The first time I went to the ER because I was just gushing blood. I could feel it gushing.
Yeah.
And one of the nurses was just like, oh, that's just regular, postpartum bleeding. I was like, no, I've had a baby before. This is not regular postpartum. I'm soaking through pads. I'm soaking this is not normal. I felt so dismissed. And, fortunately, I was just advocating for myself, and my husband was advocating for me too. Like, look, no, y'all not gonna send her home. So with that, they found out that I had an infection in my uterus, and they kept me and gave me antibiotics and stuff like that. So I had to pump them up, and I thought that everything was good, everything was over, and that was at 8 days postpartum, and then at 4 weeks postpartum, I started bleeding again, and it was just again gushing, and I was just like, okay, we're going to a different ER because I don't like the way that they treated me at that one. And the different ER did ultrasound and all that stuff. It was like, okay, we see some things still in your uterus. We're not really sure what it is. We're going to give you this medicine to get your uterus to contract and cleanse all that out. And with the C-section, there shouldn't be any placenta or anything. Right. They should have cleaned that all out. So they didn't know really what it was, but let's just go ahead and clean it out. So they did. And again, I had to pump it up, because it was a medication that's not safe for the baby. But I was good. After 3 days, I stopped bleeding. So I thought I was fine. And then at 8 weeks postpartum, I started bleeding again. And I was just I was done. I was so done. I just told Sean, I was just because it was the depression and things going up. I was just like, you know what? If God take me, God take me. Sean's a really good father. The baby be all right. It was just, and it's really sad to think that that I was at that point. Sarah, you froze up. Are you still there? Okay, yeah. Okay. So it was really sad.
You were saying that the depression was coming on.
The depression was coming. Yeah, where I was just like, you know what, whatever. If I leave, I leave. Sean's a good dad. The baby will be all right. And I didn't go to the hospital for a week. And it was actually a friend of mine who I went to grad school with. Your internet's messing up still, Sarah. Okay. And we went. Yeah, you're a little pixelated and blurry. We went to we went out to eat, and I remember we were at California Fish Grill. Actually, it's really good. And I got up, and I had soaked through. I had double pads on. I soaked through double pads in my pants onto the chair. Wow. What's going on? I was like, well, actually, I've been bleeding for a while. This is the third time. I just don't want to go back to the doctor. I called my doctor. She said that, she'll do a D&C to clean out my uterus, but she doesn't have an appointment for another 6 weeks. She was like, what? She was like, girl, you cannot wait 6 weeks. And she was like, look, I have the name of the doula. A black doula. I'm going to send you her name. I want you to reach out to her or whatever. And, and then just go from there. But this is not okay. Maybe you need to go to a new doctor. Yeah. And so I, sent a text message or whatever and talked to her on the phone. And she was like, look, if you need me to call your doctor, I will call your doctor. Make sure that you get. I was just like, you know what, I don't know.
And this is so frequent. We get fatigued from fighting for ourselves for so long that you want to give up. And you're just like, you know what? I'm tired. And people are asking, and it takes kind of your support system to say, no, that's not okay. And I think the pain gets normalized to us. Like, well, I'm in pain all the time. Something's always wrong. So I quit. I don't want to go to the ER anymore.
I'm done.
I'm done. I don't want to go.
Take me down, Lord.
Yeah, take me down. I'm done.
Yes. And so she was like, I'll advocate for you. She was like, you know what? I think you need to go to a different doctor. I know some people in your area. She's in LA and I'm all the way out in Fairmont. She was like, I want you to call this other doctor. She was like, matter of fact, have your husband call. Because sometimes they respect more when it's a male voice.
Yes.
So
and a white male.
Yes. Right. So he called and he was just like, and the doctor, phenomenal. He, Dr. Norman Lamberty. if I ever have a baby again, which, probably won't happen, I'm going to go to him. If I have any gynecological problems, I'm going to go to him, Jude is bad. He speaks like 5 languages. He mostly sees people of color.
Yeah.
And he's just like, okay, I'm not on your insurance panel, but I want you to come in through the ER tomorrow. So we don't even have to worry about insurance. So I was like, okay. When I got to the ER, they had a room waiting for me. They're like, oh, you're Dr. Lamberty's patient. They had a room. I was floored.
What?
I never expected to be treated that way, right?
Yeah.
And then when I got to the room, I felt like I was on House. You remember the show House?
Yes.
Claremont, California. I felt like I was on the show House because it was Dr. Lamberty and a team of physicians who were trying to figure out what was going on with me. They were like, you're 2 months postpartum and you're breastfeeding. You shouldn't be bleeding at all.
Yeah.
And the fact that you're soaking through pads and you're, hemorrhaging like that, something's wrong. He was like, could be something with the lupus, but we're going to explore everything, to see like what could be going on. Maybe it's, not, maybe it's something in your uterus, whatever. And the doula actually told me, she was like, so she, first of all, referred me to the doctor. She told me some herbs and stuff and some teas that I needed to take, including this nettle tea and red raspberry or whatever. And then she was just like, ask them for this procedure. So I asked them, I was like, I would like a hysteroscopy. And the resident was like, that's a good idea.
Suggest things to them sometimes, you really do.
That's a good idea. And what a hysteroscopy is they put you under, so it's a major, surgery or whatever. They put you under anesthesia, and then they send a camera up your cervix into your uterus to look and see what's going on. And so I was hospitalized again. This is the 3rd time now. They did the hysteroscopy and they did the DNC. He did a complete clean of my uterus. And and I haven't bled. I had a period, but like I hadn't bled. Like he saved my life. And he showed me the pictures afterwards. He was just like, this is what was going on in your uterus. And he was trying to rationalize what happened with these other 2 encounters that I had at these doctors of, why that happened to me. He was just like, I imagine when you first went in, the priority was eliminating the infection.
Right.
Because that was the priority. Right. And they figured, your lupus would, your uterus would clean itself out. Your uterus cleans it out.
Right.
He was like, and then the second time, they gave you the Metrogen to contract your uterus on its own as a least invasive, because if they would have at that time just gone in there and scraped, that would have been dangerous if you just had a C-section.
Right.
He was like, but now you're 8 weeks. That C-section is healed. We went ahead and what it found was my uterus was holding on to blood clots. I was holding on to blood clots. It wasn't being released, so I kept hemorrhaging.
Yeah.
So anyway, that was to make a long story long. But that touched upon so many different things: the symbiotic relationship between the fetus and the pregnant mother, and how Black women are dismissed, and we need people to advocate for us. We need our doulas. We need our women of color professionals to, who are going to be on our side.
And I think that points out that sometimes when you're sick, when you have a chronic illness like lupus, sometimes the only energy you have is to get up. And sometimes people are saying, like, you need to fight for yourself. But I think that's when it's important to have a community, because sometimes I don't have the extra energy to fight doctors, several doctors, as well as fight the air, right? To get up and to fight my own body. Because it takes advocacy, and there are so many studies that show that people think that people of color have we don't have as much pain as other people, right? That we have higher pain tolerance, we're dismissed more, and then just the nature of our system. People like to send you to the ER. So it feels kind of dismissive. Well, they'll say, oh, you have this symptom, just go to the ER. But the ER's job is to just keep you from dying in that moment.
Exactly. That's emergency.
That's it, right? And so it takes advocacy, patience, and a support team of not just doctors, but people around you who can help you figure out and sometimes diagnose yourself So when I got shingles, I diagnosed myself. I took this and I said, I Googled this, doc. I think it's shingles. And she was like, you're right. And people told us to stay off of Google has helped in so many ways. In so many ways.
Yeah, I think I would find lupus said sometimes I have to diagnose myself.
Yes, absolutely. So before we get to questions, I wanted to touch on just the mental health aspect of this. How do you stay sane? For me, it was knowing in my gut that something is wrong in my body, but nobody believes me.
Right.
Something is wrong in my body, but nobody believes me that something's wrong. That was crazy making. So I had that kind of crazy making thing and this sense of dread. And then also at the same time, I lost those two babies in the middle. And so I was dealing with grief and trying to figure out, is this baby going to survive? Because I know something's wrong. And they don't believe me, and they're telling me that she's going to survive, but they're also telling me that nothing's wrong with me. And I know for a fact that something's wrong. So I can't trust that. And so what that took for me as a woman of faith was to release and surrender my entire situation in that way, and then to take it minute by minute and to do. So in the Frozen 2 movie, I love it, where she has that song, just do the next right thing, right? So just do one step at a time. And I couldn't think too far in the future because, I mean, we could die at any point in time. So if I just thought, what if I die? What if I die? What if the baby dies? What if the baby? It's too overwhelming. I cannot think too far into the future, especially with chronic illness. The first thing that I did wrong was thinking too far into the future or thinking about when this happens or what if this happens. I think about what gifts do I have today? What capacity do I have today? What limits do I have today? And I work from there. How can I steward my gifts well, given what today has given? So today, for an example, I knew that I had this talk that I really wanted to do, but I woke up in a flare and I was exhausted, couldn't open my eyes after an hour. So I knew I'm gonna just take a nap, I'm gonna set my alarm, and I'm gonna wake up and do this talk. And after this talk, I'm gonna take another nap.
Yes, it's on my agenda.
Right. And then I'll have to go to the doctor to get my blood because I had to fight for myself. And they were like, we don't know what's wrong. Well, something's wrong. So I had to email them several times and say something is wrong. And then I'll go get my various kidney levels checked because I think something's happening there. And so all of that takes mental energy, and it's very tiring and depressing. And there's waves of grief that come, which is a little bit different than the depression. The grief comes when you think about the things that you've lost and the lifestyle that you've lost. And then the depression comes when you feel tired of fighting.
Yeah.
Yeah,
when you lose some aspect of hope, it's just like, they're not going to believe me anyway.
Yeah.
This is not going to get better. This is lifelong. And that, you can really defeat yourself with that.
Yeah.
So it is a intentional struggle. You have to be intentional about combating those thoughts.
Yeah.
About changing things around. Like, okay, yes, I feel this in this moment. But I felt better before, and I will feel better in the future. Like what Curtin was at, we did it before, and we can do it again, and we can do it again. Okay, anyway.
I don't know that one, Monica.
But just you have to maybe that comes in the way of affirmations.
Yeah.
When you're reminding yourself of scripture that, even this, what you meant for my harm, God worked it out for my good. Look at the story of Joseph. Everybody tried to, his own family tried to put him down and defeat him, sold him into slavery. Potiphar's wife, that helpful. You know, it's just so, like, you know what you meant to destroy me, God, turn it around for my good. You know, turn my weeping, my mourning into dancing, you know, so.
Yeah. And that kind of meaning making.
Yes.
That kind of meaning making is what makes me think of you. So when I try to go through the trauma, so one process when you're going through trauma, one thing that is helpful to develop resilience is to be able to make meaning out of what happened to you. And so as I was making meaning out of my 2 miscarriages, I posted on my child's 2nd birthday about how she was alive and the story of that. And I told you guys before, I have no recollection of having this aspirin conversation with Monica. No, and I'm really good at remember. I have an amazing memory. I have 0 recollections. And so then when she commented on that post and said that I was the reason why she took aspirin, that turned my mourning into days. That gave meaning to the pain that I went through. So because of that 2nd miscarriage, 2 babies lived. Ellie lived, my daughter lived, and Caden lived. And that was worth it to me. So I would never wish that on anybody, but God used that dead ground to grow 2 flowers out of. And I think that those are the moments when I think about that and I get ready to give up. Those are the things that I think about. I think about God doing that. So lupus is big, but grace is bigger. And God's power and rejuvenating spirit is bigger. And I look at Ellie, and her name means God has answered me.
I love that, and I'm just really grateful. Sorry.
It gets me too, girl. It gets me too. Yeah.
So, let's answer questions.
Yeah. Any question? Yeah. So I think somebody's question was you mentioned chronic kidney disease in pregnancy, and I have chronic kidney disease. I'm in stage 3, and they did tell me that I shouldn't get pregnant at this point in time, but I think that's because of some of the other complications that I have. And so I think that question is a very personal question to ask you, your partner, and a team of doctors that you trust. And that if you decide to go down that road, you'll need a team that's on board, and you'll need a good team. I cried. Just kidding. Wow. That's my mom, I think, who just wrote that, guys. So just ignore that comment where it says crybabies. Anyway, so a good rheumatologist, and then not just an OB, because OBs have no specialty, and they don't understand lupus at all, I've learned. So to get yourself like a maternal, like a specialist, a fetal specialist, like my doctor who told me to take the aspirin. Yeah. I think if you're going to have a high-risk pregnancy like that, you need a high-risk doctor. You don't need just a regular OB. You might have to have one because of your insurance, but you need to demand a high-risk doctor as well.
I had both. I had to see both.
Yes. Yeah. If you're going to go down that road, you need to have a team that is on board with you.
Yeah. What other questions do you guys have? Go ahead and type them up, or me and Dr. Hill just gonna keep chopping it up.
Just gonna keep chatting. While they're typing, Dr. Led, I'm curious to know how you have handled the mental strain of lupus, especially as a mom.
Mm-hmm. Yeah, so one aspect of it I actually talked about in the Raising Strong Daughters live thing that I did on this Sunday. And one aspect of it has been guilt, because I can't do everything that my older daughter needs me to do. So, for example, I used to be able to, whatever, fill in the blank. Like, we run relay races, or she wants me to, help her with the homework, and then cook, and then this, and then that. And and at the time I was working full time, and by the time I get home, I have nothing left. And then on weekends, I'm sleeping. Like, I'm just making up. And I felt like, wow, I wish that I could do all these things that I want to do with her and for her. And what I had to do was kind of backtrack a little bit and say, like, okay, well, what can I do? Mm-hmm. We can watch a movie together.
Yeah.
We can go to the movies together. Yeah. We can play some cards. I had to really adjust our activities to fit within my body's physical limits, because I could ignore my body's needs and limits and just kind of go for it anyway, and then I would pay for it the next 2 or 3 days.
Or end up in the hospital.
Exactly. So I had to really adjust and then just have very open conversations about that. Like, hey, look, mommy's tired. This is what I can do. Someone said, what age do you think is a cutoff for lupus patients get pregnant? It's really hard to say. I can just disclose, for me, I had my last baby when I was 34. And so I was, high risk from the lupus, but then it's just like, deep run on the edge, girl. But then I know some people who are, younger and older, so that's really a conversation to have with your doctor. And, one thing that a lot of people may not realize is that you can have these conversations as you're thinking about getting pregnant. One of the things that my doctor told me, for example, is make sure that you have a 6-month period of having no flares before you try to get pregnant. Yeah. So that's, something that your doctor may tell you as well.
Yeah. If I really wanted to get pregnant, I would go to them and say, I really want, this is important to me and my family. How can you help me get there? So instead of asking a question like, do you think this is possible? First of all, God, I didn't think it's possible. But I would say, right? I would say, this is what I want. How do I get there? And then figure out a way to get to that point.
Right. And then, like Dr. Hill said about having a team around you, like, I recommend having a doula. And I didn't know about them before. Like, actually at the beginning of my pregnancy, I was like, I should get a doula. And my mom was like, you need somebody to help talk to you and rub your back while you deliver, and I'll do that for you. You don't need to pay all that money. I was like, okay, Mom. But the fact that I had one postpartum who helped save my life, I'm like, look, if I ever get pregnant again, if anyone else gets pregnant, I'm like, look, you need to go get a doula. There is the National Black Doulas Association. They have an Instagram, a Facebook page. Just reach out.
Yeah. And some of them are covered by insurance. And we saw there's another question that says, is there an age limit? We're not sure. So these are our own experiences, and we have no kind of expertise in that area. I would talk to your team about that and to see what is it that you want to do and how can they help you get to that point.
Yeah.
So are there any more questions? Because if not, we can do our drawing. Yeah, we have 2 minutes left. So
yeah.
Okay,
so let's do our drawing before we get cut off. And then if questions come in after that, then we can still answer them.
Yeah.
So, if you guys saw our post yesterday at Dr. Blied and at Dr. Sarah Ashley Hill, we shared that if you guys followed both of us and then tagged a friend in our post, then you would be entered to win not one, but two $5 Amazon gift cards. Oh, someone said,
while you're pulling out answer. Oh, you want to answer it first, and then while you're pulling out answer?
Yeah, go ahead and answer.
Okay. I'm handling COVID by, I cannot leave the house. First of all, I was already housebound before. I have severe immunosuppression because of the kidney medicine that I'm on. And then they actually tested me for COVID because I was sick for a very long time. And my test came back negative, but my doctor said, possibly you still had it. But I have to be really, really strict about it. I can't go anywhere. I was having some heart problems, and the doctor was like, unless you're about to die, please don't go to the ER because it's way too high risk for you at this point. And so my husband actually had some N95s, and I was going to donate them to our nurse friend, and she was like, no, you have lupus nephritis, you need to have that N95 on your face.
Yeah.
But what's interesting is I'm not that scared of COVID, and my mom mentioned, she was like, well, feels like your body's always trying to kill you anyway, so what's a little corona on top of it, right? But that's been helpful for the fear aspect, is to realize that, like, my awareness of my mortality has been really helpful in not freaking out, because I realize how I don't have control over these things and how I can do the best I can with what I can. Some things can't be avoided, and when that hurdle comes, I'll do my best. And until then, I sanitize. I stopped using my hippie stuff of herbal infused vinegar, and I started using some bleach for a second. But just bleaching everything, just bleach it all. But sleeping a lot too, just to make sure that I have an immune system to be able to fight, because mine is already small.
Yeah, that's so important. So, it's like, okay, COVID-19 is out of our control, right? But what is in our control is kind of trying to minimize the triggers for lupus flare-ups, which are, actually I just posted to my story today, the most triggers for lupus. Number one is stress. Yep. Number two is the sun, and it's hot. Well, here in Southern California, it's hot, and we in the Empire, it's hot. But you're in Sacramento, it's hot. And so, just minimizing the UV rays and keeping in mind that with lupus, it's not just the UV rays from the sun, but also fluorescent light.
Yes. Yeah.
So even if you're inside, you need to also, have on your sunblock. And I use Neutrogena Clear Skin SPF 50 sunblock. Oh yes, you got it. So with this lovely brown skin, some sunblock make you look dead. Like it's great, it's horrible, like not made for women of color. But that one is actually, I have it on right now, and I'm actually not wearing any makeup except for on my eyes, and it looks fine. It doesn't. Yeah, it don't look gray or dead. So yeah, always wear sunblock. And went to a lupus conference. We need to rush this up.
Yeah, what they
said was that with the sun, just the amount of sun going from your car to your house, or from your car to the inside of the grocery store, is enough to impact your body. And what happens is, in these tests that they were doing, they see the results on the internal systems up to 3 weeks later of the sun exposure. So that's just something to keep in mind. You may not feel it immediately with the fatigue and stuff. I do, but it could be affecting your heart or your brain or whatsoever. Let me hurry up and do this thing. It says my mom is a root. It's a root? What's root?
A who?
A root. Okay, I'm gonna pull two people.
Okay, pull two people.
I define lupus. What is that? Explain what you mean. All right. So first person is let's see. Lupus 101. Lupus 101. Are you here? Because you do have to be present to win.
Are you here, Lupus? I see her on the viewers.
Lupus 101.
Yep.
All right. I'll see that person commenting. Oh, there you go. Hey, girl. She's from London. I was actually listening to her live this morning. It was so good. Beautiful woman. All right. So second winner for the second Amazon gift card, House Foundation. I didn't see House Foundation join today. I don't think Kim made it on.
Mm-mm.
All right. So here's the backup winner, because we only got 3 minutes for IG is about to cut us off. Kit Kat Meow. Kit Kat Meow, are you on?
She's not on there.
Oops. Okay. Winner. Let's see. S Party Chicks.
I think I saw her on there. Yes, she's on there.
All right. Congratulations.
All right. So
Lupus 101 and S Party Chicks. Go ahead and DM me with your email address, and I will send over Wait, how are we gonna do this?
Yeah, just you can send them. They can send you their email addresses, and then I'll get one of them.
Okay, yes, because we're gonna send you your Amazon gift card. You will get it today. What you gonna buy me with your Amazon gift card? I'm just kidding.
Thank you guys for joining.
Yeah, thank you guys so much for joining. I tried to do the screen record, so hopefully this recorded and we can do on IGTV, and you guys can share with your friends who are either had a baby or are trying to get pregnant.